Hi, my name is Dr. Jolie Silva. I'm the clinical director at New York Behavioral Health. I'm going to talk to you today about preschoolers. And if you have a preschooler and you think that there might be some developmental delays with your preschooler, I'm going to give you some quick tips on what to do if you have any concerns about your child. So when we talk about development of preschoolers, we can break it down into a couple of different categories. We have physical development, which involves walking, running, gross motor skills. Then we have fine motor development, which involves how well they write. Fine motor skills usually have to do with the hands. Then we have speech and language development. Now, speech and language are two separate things. Speech usually refers to how well they are articulating words, and language is broken down into two components, one which is expressive language. Expressive language means how well your preschooler is able to express the thoughts that are going on in their heads. And receptive language is, do they understand what you're telling them? So there's expressive and receptive language. And so those are three of the main components we look at when it comes to development of children. And there are other components too. But first thing you should always do is check with your pediatrician to see if there are any medical concerns or if any of the delays you think might be happening have to do with an underlying medical condition. Once that is ruled out, your next step, especially in New York State, this is free, and I believe all across the country it is free through your school districts. It's an evaluation that you get through your school district through something called CPSE, the Committee for Preschool Special Education. And whether you have minor concerns or major concerns, if you put in a request to have your child evaluated through your school district, they are mandated to evaluate your child for free. What you do is, first you have to prove your residency that you live in the school district. But if you have older kids in the school district, you already have your residency proven. And then once you do that, usually the first step is that their child would meet with a psychologist to go over your concerns. Your child would have an IQ test done and maybe some other testing done. And then either a physical therapist, an occupational therapist, or a speech and language therapist would evaluate their separate component to see if there are any delays. Now, depending on what state you're in and what district you're in, services may vary. Some states are a little bit more generous with the services that they give to children, and some are not. Another option, too, is if they recommend your child does not get services through the district, but you really think that they need them, you can always get a medical provider to provide those services, and then your insurance company would pay for it. So if you have any other questions about preschool development or what to do if you're concerned about your child's development, you can visit our website at newyorkbehavioralhealth.com. That's NEWYORK, behavioralhealth.com. Or you can call the office at 646-599-3498. Thank you.